And the example I give you is it's a simple analogy. You came home with a bag full of groceries, and both hands are tied up. You open the door, you basically with your foot, you just open the door and go inside the house and put your groceries on the kitchen table. Now, you have the door open, and with the open door, there's a wind blows in, all kinds of winds and dirt and leaves and all kinds of things comes inside your house. Well, as a good person you are, you start cleaning your house. But guess what? Your house will never be clean because the door is still open. Right? So the first thing you got to do is you got to stop the door. You got to stop the stress that's causing the damage in your house. Close the door. Oxidative stress has to be shut down. That's where the glutathione comes into play.
Most people don't realize how critical magnesium is, especially when it comes to oxidative stress and recovery. Low magnesium levels can actually reduce your body's ability to produce glutathione, your master antioxidant, as we're learning in this podcast. That means more inflammation, slower healing, and even increased oxidative damage. That's why I personally take magnesium every single night. Magnesium Ease is a highly absorbable magnesium supplement made by Breast Cancer Conqueror that helps support antioxidant activity, reduce stress, and promote deeper recovery. So if you don't currently take a magnesium, head over to our store to check it out and see if it's a good fit for you. Welcome everyone to another episode of Wellness Warriors. This is Deanne Richter, head coach at Breast Cancer Conqueror, and I am here today with Dr. Nayan Patel. Very excited to talk with Dr. Patel. He's going to talk with us a lot about glutathione and his new book he has out, which is very important and something that many people that listen to our podcast are interested in, and how to use glutathione in the appropriate way, depending on the person. So just to give you a little bit of background information so you know who Dr. Patel is, he is a renowned pharmacist and wellness expert with over 25 years of experience working to create personalized medication and nutrition plans. He has been a go-to pharmacist for celebrities, for CEOs, and even for fellow doctors for years. Dr. Patel recently published a book called The Glutathione Revolution, Fight Disease, Slow Aging, and Increase Energy. And in this book, he shares his decade of research on the powerful antioxidant glutathione. He is a global authority on glutathione, and he holds the only patent for transdermal glutathione. And he loves educating people and practitioners worldwide on topics like biochemistry and anti-aging. Alongside his global work, Dr. Patel practiced as a licensed compounding pharmacist, designing custom treatments for athletes, actors, and patients in his community, where he has practiced since 1997, which is very impressive. And besides being a pharmacist CEO, he is also a father to his 3 children, a husband to a wonderful wife, and a son to a father who is his inspiration, I should say, to help heal the world. So quite a background, very impressive. Nice to speak with you and be with you today, Dr. Patel.
Well, thanks for having me, Deanne. So appreciate the time today.
Yeah. So I'm very interested to dive into the topic of glutathione with you because, as I know I mentioned, our listeners would be very interested. Everyone hears a lot about glutathione being a powerful antioxidant, but knowing from the expert exactly what it is and how to use it is going to be very beneficial. So would you just start off by kind of explaining to us, I should say, the importance of glutathione in things like cellular health and detoxification?
Absolutely. So the first question is always going to be the important part, because understanding why you need glutathione is critical. Before I answer the question, what we should do, we should all know this, that the body produces glutathione as the most abundant molecule in our body. Mm-hmm. And so our body does not do anything out of ordinary. Whatever it does, there's a purpose behind it. And if there's a purpose behind it, our job is, as human beings, is to find out what the purpose is. And so far, we have found a couple of things. Mainly the first one is antioxidant benefits of it. And the reason we talk about antioxidants is because if you think about it, top 10 leading cause of death in the world, one of them is accidents. Let's take it out of the picture. All the other leading cause of death in the world besides accident is linked to oxidative stress. So Oxidative stress, we need antioxidants. I mean, that's a simple thing, right? Oxidative stress, if you think about cancers, autoimmune conditions, metabolic disorders, heart disease, you can just name the disease that goes down the list, and they all have links to oxidative stress, either in the early onsets of the progression of the disease or on later stage where it just takes a nosedive and just gets you out of this planet, right? So either way, our goal has always been, what can we do to reduce oxidative stress? And that's the reason why glutathione is so important for us. It is, I always tell people that, hey, you know what? No matter what you do, would you stop breathing? Well, you can for maybe a couple of minutes, 5 minutes, 10 minutes at the most. And by that time, if you do not get your air in, you're dead, right? Well, the second part is, well, can you survive without drinking water? Right? Maybe. What? There's a time limit. Couple of weeks, couple of months at the most. I don't know. Maybe less than that. But there is a time frame where it's not going to be years, right? It's going to be weeks to months, and that's going to take you. That'll be the end of your life. The same thing goes for glutathione. It's the third most important thing in your life after water and air, and people don't think about too much. You know why? Because we take this body for granted because the body produces so much abundantly on a daily basis. And so I want to reassure people the importance of having glutathione today more than anywhere else before, because of the very reasons, because without glutathione, you will be experiencing unexplained diseases, end-stage conditions, and as much as dying from it too, very, very fast. But our body produces abundantly, so we take it for granted. And that's why people don't talk about it too much. The other reason we don't talk about it too much is because for the 140 years that we have known about glutathione, nobody's ever figured out how to actually enhance them inside your body to the high normal ranges. And so if we cannot do anything about it, then let's not talk about it. So anyways, I'm glad you're talking about this today, and thanks for having me today on this podcast for you. But I'm hopefully I'll clarify some of the misconceptions that people have today.
That's a pretty powerful statement. So breathing, water, and glutathione.
It is scary, but when people say that for the first time, they guess, really? I say, well, try to figure out what would your body be like if there's no glutathione.
Mm-hmm. Is there a question for me? Yeah, I was going to say, would you tell us what our bodies would be like without glutathione?
So keep in mind, first of all, the thing that comes out is from the two things that it does that we know of for majority of the time, which is antioxidant, cleans up all the free radicals outside your body. And the second part, it's a master conjugator. That means it combines with other metabolites, chemicals inside your liver and helps them detoxify and get rid of it outside your body. Mm-hmm. And the example I give you is a simple analogy. You came home with a bag full of groceries, and both hands are tied up. You open the door, you basically with your foot, you just open the door and go inside the house and put your groceries on the kitchen table. Now, you have the door open, and with the open door, there's a wind blows in, all kinds of winds and dirt and leaves and all kinds of things comes inside your house. Well, as a good person you are, you start cleaning your house. But guess what? Your house will never be clean because the door is still open. Right? So the first thing you got to do is you got to stop the door. You got to stop the stress that's causing the damage in your house. Mm-hmm. Close the door. Oxidative stress has to be shut down. That's where the glutathione comes into play. But the issue is, if you do close the door, does the debris in your house going to clean up by itself? No. You still have to do the work to clean up all the debris in the house. And once the debris are collected, glutathione can also help take the trash out of there, right? So think about it. Your body is constantly open to environmental stressors that you basically that making your body toxic from inside, right? You got to stop that somehow. Once you stop it, then the body has to clean it up, and once you clean up, the body has to get rid of it. Mm-hmm. So it helps stop the oxidative stress, and it also helps you detoxify your body. By all means, that's the two most important things in our life, right? It's, if you imagine, if you knew that if you eat a banana, that you'll never come outside your body. Would you eat a banana again? Never, never, because you know it's not going to come out ever, right? And so people do things like if you take medication, this one you can only take it once a day, or this one's only once a week, or this one only once a month, right? And there's a reason for that is because it does not get rid of it by your body is not able to get rid of it, right? So I want to make sure people understand the importance of glutathione is just to keep your body clean from inside out. And it's just cleanliness is not just debris. Your body produces a lot of proteins and peptides, and your body is full of bacteria and fungus and cancer cells and all kinds of things. They all have to be kept under order. And to keep them under order, you need a powerful immune system. Guess what? Who enhances the immune system? The immune system is enhanced if we have less oxidative stress and less toxic chemicals to deal with it. Your immune system is already enhanced. So it's not a direct immune response, but indirectly, it absolutely helps you to keep all the other things inside your body in proper check.
Very interesting. I love your illustrations. It's good to, I'm a visual person, so I like to have visual illustrations to go with your answers. So our listeners are going to primarily be women who are either preventing breast cancer or potentially even currently undergoing a cancer healing journey. They're actively in treatment. So should someone who is undergoing cancer treatments or has cancer, should they be cautious or aware of any issues with taking glutathione supplementation?
So there are numerous articles out there that suggest that the glutathione is absolutely contraindicated when using chemotherapy or radiation therapies and things like that, because glutathione is labeled as an antioxidant. And all chemotherapy, radiation is a pro-oxidant. And so in theory, you cannot give a pro-oxidant to heal somebody or to kill something and an antioxidant to prevent it, right? So it's like, hey, you know what? That doesn't work, right? It's like you're sending a soldier and a doctor at the same time in the war, right? I said, oh, we'll shoot you, but there's a doctor who's going to take the bullet out of you, right? No, it doesn't work that way. And so in that theory, it makes sense to make sure that people understand the true meanings of what glutathione does in a body. And I'm not here to tell you that you should or you should not do glutathione at all, but I want you to start asking questions, right? One thing is you got to trust somebody. And I might trust my oncologist more than anybody else because it's him or her who's basically trying the level best to make sure that I survive, right? And so I'm going to trust that person first. But at the same time, that doesn't mean I can ask questions. It's like in God we trust. Everybody else, please show me, please verify. Right. And so I just want to verify. So when I work with oncologists, I just ask questions. If I take glutathione, it is not going to feed the cancer cells, but there's a potential that it may protect the other cells surrounding the cancer. Because when you do chemotherapy, it's not targeted. It's killing good, bad, and the ugly, right? And I want to protect the good cells because they didn't do anything. They didn't do any harm. We need those cells to survive. And so we work with a lot of oncologists. Interior oncologists is what we work with. And they've been using concurrently with chemotherapy all the time, right? Is it everybody? I don't get those numbers, but I know the oncologists that we work with have used it with prostate cancers, breast cancers, colon cancer, especially liver cancers. Oh my God, a lot of those patients are those people. And so the oncologists have been using this concurrently with the chemotherapy because glutathione by itself is not it's not a cancer prevention or cancer treatment drug ever. That's not his job, right? His job is to get rid of the stressors out of your body. If you get rid of the stress out of the body can think better, can heal better, can heal faster for us. And so to me is if you're dealing with active cancer, yes, work with them. People have used concurrently with the chemotherapy, but if you're looking for solo therapy, glutathione is not going to be helping you. The second part you asked question was that can be used as a prevention. See, Uh, Anything can prevent cancer, right? Breathing can prevent cancer.
Right.
You can make it a point with any product that you do. If it's good for you, it can prevent cancer.
Right.
So I'm not going to go there. What I'm going to go is that if there's a possibility that I can reduce the amount of work that body has to do for you to keep itself in proper balance, I can bet that the body is going to be able to deal with the cancer cells much more effectively as soon as that's increasing. And that's one of the reasons why we recommend people uh, to breathe clean air, to drink clean water, not to drink sodas and not to eat sugar contents, because it's all basically feeding the body, making the body work harder than it has to. And when the body's working really hard, it's not working on the cancer. Right? And so with the glutathione, it is absolutely important to reduce oxidative stress. It is also important to conjugate and remove all the toxic metabolites. And some of those metabolites are actually toxic. For example, in women, estrogens and testosterone metabolites are actually toxic to your liver. And those metabolites have to be processed and get rid of it. Now, most of the women that I work with, they're either taking some sulforaphanes and DIMs and indole 3-carbinols and trimethylglycines and calcium D-glucarate. And I can go on and on and on about the products they've been using to somehow get rid of those metabolites. Guess what? The body is not made of all these herbs. The body is made of peptides like glutathione. Glutathione by itself can remove all the metabolites out of your system. And you can measure them in the urine test, a blood test, not saliva test, but blood test and urine test. You can measure those metabolites and see that those levels go down. And so you can do that naturally. You don't have to take any herbs or some vitamins to do that for us. So in that sense, yes, it can help reduce the load that is actually can trigger the growth of cancer cells. So I just want to make sure people understand that this is not a cure-all, but it is absolutely going to be important to keep your body in check, keep your body healthy. If a healthy body doesn't get cancers.
Great answer. I love that. And I love all the points you made. I'm very on board with the same thing you said. We always tell our clients to not hide anything from their oncologist. You have to have those communications to make sure that they know what you're doing. But similar to what you said, you can bring studies to the oncologist. You can, there's lots of studies that do support antioxidant use alongside chemotherapy. So you can bring those studies, you can share with them what you're going to do, and again, have that open communication.
So I want to briefly mention about the antioxidants, because people think antioxidants are in the environment, like vitamin C. Vitamin C is not an antioxidant. And that's something that people cannot wrap their head around that. And vitamin C is actually a pro-oxidant chemical. But at low concentrations, vitamin C actually provides enough energy to oxidize glutathione inside your body and make them into reduced form again, make it more active again. And so at low concentration, vitamin C is actually an antioxidant, but it's actually giving the energy to glutathione. And higher concentration of vitamin C is basically a pro-oxidant and is used for chemotherapy. Right? People do high dose vitamin C. I mean, vitamin C is not that smart of a molecule. It doesn't have dual properties. Only has one property. Okay. And so do not give too much credit to vitamin C and say, oh my God, it's a miracle molecule. No, it's a very simple molecule. It's not produced by human. Whatever vitamin C can do, glutathione can do 10 times better.
Yeah, good point. Because that's been my understanding as well, as other things that maybe we've thought of as antioxidants you generally get from food or environment, but glutathione is something that's actually made within your body. Your body makes its own.
That's right.
So that kind of leads to my next question. I know that you have a really high-tech delivery system, a supplement that I want to talk about next. But first, for someone who's just kind of starting with glutathione, are there things people can do naturally to help boost their body's production of glutathione?
There's two things they have to do. And it's not like if I don't do those things, I can just take the supplementations. No, you have to do these two things first, and regardless of glutathione or not. One is reduce the things that eats up all your glutathione levels inside your body. Stop overexposing your body to sun. I say overexposing, and that doesn't mean you don't go out in the sun at all. I just said if you go there for hours, not a good idea unless you cover up your whole body. Reduce your exposure to toxic chemicals, pesticides, fertilizers, pollution, things like that. Whatever you can reduce it down, do it. Right? If there are fires, fires creates the products of combustion is the most toxic chemicals inside your house now because of the fires you have inside your house. So if you have a wood burning fireplace inside your house, change it, right? Because that's causing a lot of pollution that your body has to breathe that depletes your glutathione level. That's the first thing. Second thing is also, the first thing is also there's something called alcohol. Alcohol is a solvent in a chemistry. Solvent is nasty in my lab, right? But with a little bit of flavor, it's like the most social product drink in the whole world, right? And all social gatherings starts with alcohol. Unfortunately, it's such a sad thing. But if we can reduce that, they'll reduce the use of alcohol, use of glutathione completely. So anyway, I want to make sure first thing is do whatever it takes to preserve the glutathione levels. And once that is done, the second thing is there are foods that you can eat that can enhance your levels dramatically. And so glutathione is made up of 3 amino acids, glycine, glutamine, and cysteine. Glycine and glutamine is abundantly found in lots of food sources. Cysteine is the one that is not abundantly found. It smells funny. People don't like to eat that food all the time. So what I would suggest is that just put in your favorite search engine or your AI robot. Everybody has this AI robot. I said, ask the robot. I said, hey, what are cysteine-rich foods? And then give you a list of your vegan choices, your vegetarian choices, your carnivore, your omnivore, your paleo, your keto. I don't care what diet you're on right now. It doesn't really matter. But you're going to get all those choices, and you have to eat those foods every single day. There's two things you have to do regardless. And if you do those 2 things alone, your body can actually produce glutathione for the rest of your life. No problem.
Support your body's ability. It goes hand in hand with what our coaching program uses. We have 7 essentials, but 2 of them are food and reducing toxic exposure. So there you go. Yeah. So again, so we can boost it naturally by reducing exposures, eating the right foods. But then I know you also have a patented delivery system of glutathione. So would you explain a little bit about that and the difference between it with taking glutathione IV or maybe an oral supplementation?
So glutathione has been known for 140 plus years, but nobody's ever figured out how to get it inside your body. Back in the 60s, FDA did approve something called N-acetylcysteine as an amino acid, as a drug to enhance glutathione levels inside your body. 2025, this year, is still the same drug available in the market today. There's no new advancements ever happened in the last 60, 70 years in glutathione supplementation, which is kind of sad, right? The most abundant molecule produced, the best thing that we ever needed, but nobody's ever figured out. And so I started this journey back in the 90s to start making the products for glutathione. And we made the first liposome technology product, and liposome was at that time was kind of new. Not a lot of people knew about this thing. But so I said, hey, this would be a great way to deliver glutathione, vitamin C, CoQ10, things like that, right? And so we made that product, and 2 years later, we found out that it was not working for all my people. I was not getting the results I was promised with the help of glutathione. The literature supports one thing, but I see in the real world, I said, I don't get the results. So in 2001, I started making into injection forms of glutathione. And sure enough, I thought that's going to be changing the world. And it only worked for like 20, 30 minutes. I said, what's going on, right? Why is it not working? Because when I inject it, it works great, and then it just fizzles out. And so I went back, and it wasn't a couple more years later, I found out that, oh my God, The research suggests that there is no, you don't absorb. Even the IVs, it doesn't stay in your blood at all. It stays in the plasma, and the body basically filters the plasma every 5 to 15 minutes, and everything's in the kidneys, and you just pee it out. Mm. I said, oh my God, this is what I've been noticing. So what's going on? And so about the time there was this new technology that was emerging, dextrins at that time, that we started dabbling our feet around. I said, you know what, nothing is working. So I recruited my partner in crime from Keck School of Medicine, USC, and medical school. He was a senior researcher in protein molecules over there. I said, hey, come on down. Let's do some work together if you don't mind. I said, I don't know. Took me another year to convince him to come work with us, but he eventually did come. And so we started our first project was to work on glutathione. And so it took us 4, 5, 6 years, I think so. And we were able to stabilize a glutathione molecule inside the lab. And we thought, oh my God, this is amazing. This is crazy. We got it stabilized. So right away, I said, hey, this is the first in the world. So we applied for the patents right away. And while the patent application was going on, we thought the doctors are going to just flock to us and just going to take this off my hands and they'll all kumbaya, right? And we'll be happy. No, nothing happened that way. And the reason is because when you put it in the mouth, it was getting broken down. Mm. I scraped my nose and it was burned my nose like crazy, but still the levels were not rising high enough. I said, wait a second, what's going on here? I find out that the body actually never absorbs any peptides from outside sources. Yeah. You can eat a muscle from a steak or a chicken or whatever, but your body will break it down and use up the amino acids and use the amino acids to make its own muscle, tissues, whatever it needs. Your body never absorbs any of those other molecules from outside sources. And so in 2011, there was a research done on the liposome technology product, and this showed the same thing. What the body does was the body breaks down the glutathione to amino acids. So it breaks it down, absorbs the cysteine, and later used to produce its own glutathione. Mm. Wait a second. Cysteine is already approved by FDA. I don't need to take glutathione to get broken down and reabsorb again. I just take cysteine, right? IVs did the same thing. It was breaking it down, absorbed the cysteine, and the cysteine actually worked like 6 hours later. They saw the results. I said, okay, so there's something wrong with this whole picture, right? And so I knew the only route remaining for me to test on was the skin route. Because that's the only route that actually has not been tested yet. But the skin is a physical barrier. Size matters. So I had to work on the glutathione molecule to twist it to make its particles small enough to get through your skin. So when I did that part, I said, another, hallelujah, done, right? Done. This is another thing done. For another patent application, I said, this is another thing that's going to work really, really good. And guess what? No, still no. Because the biggest issue was the cell barrier. It's a chemical barrier. Because you can get through your skin as a physical barrier, cell is a chemical barrier. Inside the cell is where the mitochondria is, where you need the glutathione, and oxidative stress is over there. So if I do not get there, the oxidative stress doesn't reduce. No. Right? So the goal is, how can I get there as fast as possible to quench all the free radicals and make my body happy again? Right? And so there's my second piece of technology that I created. Cell needs what? Sugar, carbohydrates, something energy source, right? So we found these polysaccharide molecules. They are ring structures. And since I already reduced the particle size of glutathione to small enough, I was able to stuff it inside these sugar molecules. And so outside, it looks like sugar or polysaccharides. The body just sucks it up. The cell just sucks it up. And inside is glutathione in there.
Well, that's like a Trojan horse.
It's a Trojan horse. And when that happened, that's when the hell broke loose for us. For the very first time, we started getting results and outcomes that we have never experienced this before in my life. And so 2023, okay, by the way, it took me another 13 more years to do all kinds of studies after that. It took me a long time, but I never released a product to the public because I wanted to figure everything out. How much to give you, how often to give you, because it's going intracellularly. So I know the dose is going to be very, very small. It can't give you big doses like I give you IVs and oral stuff. This is going to be very small dosing. So I had to find all those things out. And in my journey, I was recording all the benefits I was seeing. I saw benefits in young kids and old people and some disease patients and horses and dogs. And I said, all kinds of people, it's just everybody has glutathione. So I just sort of say, hey, what if I give a racehorse? Can he win a Kentucky Derby? Of course, I didn't do Kentucky Derby, but I did give it to a horse, and she won a race. All right, wow. And so those are the kind of stories that I started collecting data. That's my book, The Glutathione Revolution, because it's nothing short of a revolution. Because the things that we have seen, I've never seen this before.
Wow.
Eventually, we launched the product in 2021. And as soon as I launched the product, the researchers at the University in California came back to us and said, hey, if you say this is true, I'll do a brief trial just to see if it really reduces oxidative stress down. And 2023, they did the 30-patient human trials, and within 4 hours, they saw the oxidative stress level plummet.
Wow.
With one application. Imagine you're doing it twice a day, every day, right? And with that, the researchers went one step further, and guess what they did? They took the blood out. They infected the blood with infection like mycobacteria. There's no cure for mycobacterial infection. And wanted to study the blood, what happens with the blood. And guess what? Even inside the blood, the one that had the glutathione inside the blood, the infection went down.
Sure.
Not because it's an antibiotic, because it was enhancing your own immune system. It was decreasing the oxidative stress down, increasing all the cytokines, and because of that, getting rid of the infections. Oh my God. That was, to me, was a game changer, because now, if you see ants, how many ants can you kill? They can step on it, but guess what? They will keep on coming and coming and coming. When you have lots of oxidative stress that has triggered so many different systems in your body, it's like a whack-a-mole. You cannot get rid of every single thing. The only thing you can do is enhance your body's own defense system, and holy shit, everything will come at screeching halt again. And so that's why to me now, today, more and more I keep on learning about this thing. It's just crazy. Why would people even do any medications unless they've done the glutathione first? Because that to me is allowing your body to say, hey, body, I'm going to make you stronger, and you're going to deal with your own problems, right? The body goes, bring it on, give it to me, and I'll take care of it. But I understand that people have diseases and they've gone too far on the other side, so they need additional help with medications, and I get that part too. But if you're young, and if you have parents, mom, sister with cancers, and if you strengthen your body today, right? Do those things. Reduce toxicities, reduce your exposure to all the chemicals, increase your healthy lifestyle, and also make sure your glutathione levels are optimized.
Beautiful. Now, if I start seeing your name winning racehorses and Kentucky Derby horse races, I'm going to know why.
It won't be happening, because the thing is, it's not a banned substance right now, but it just makes the horse healthy. It's not about winning the horses; it's just making the horse healthy. They're living, breathing animals, and they need to be healthy as well.
Of course, absolutely. Very fascinating. So I just have one last question for you, just to kind of clarify for everyone listening. So in your experience, are there any risks or any concerns with long-term, using glutathione supplementation long-term?
How much time do we have?
You can take your time.
Okay, then I'll share with you just one story, because this thing will tell you what that means, right? Because I understand you have young people in your audience, you have maybe some older people in your audience. Old doesn't mean they are dead. They're still alive, right? I hope they are still alive. Okay.
If you're still alive,
if you're still alive, if you're listening to this podcast, if you're still alive, there's a chance. And I want to live this thing with you today, because my dad, at the age of 78, had type 2 diabetes, arthritis, blood pressure issues, a little bit on the heavy side. I was doing all his hormone replacement therapy and his healthy diet and healthy vitamin plans. And because I deal with all kinds of people. I said, Dad, I can take care of you. Trust me. I said, yeah, whatever. You're just my son, right? Because I said, Dad, I take care of really high net worth individuals. I'm sure I can take care of you too. So we took care of him, but not to the point it was he was completely healthy because he did his own thing. At the age of 78, he had some chest pains. We went to the doctors, scheduled an angiograph, and of course, his artery was completely blocked, 100% blocked. The doctor could not believe that he was still living and breathing. That he should be dead by now. He survived. Put a stent in there. Of course, it was not cholesterol issue. He was having inflammation, so he refused to take cholesterol pills whatsoever. I said, Dad, you don't have to take it if you don't want to. That's okay, because your issue is inflammation, not cholesterol. And so about the time, I was 2 years into my research, and he was my patient number 1 on glutathione.
Wow.
So
in the family.
In the family. That's what I'm saying. I was so passionate about this because it was in the family, right? At the age of 78, he started taking the glutathione. Like everything else, I was too busy in my own work. So I never paid attention to him. A couple of years goes by. I was at dinner one day with him, and he was just pounding on sugars and carbs and just like having at it. I said, Dad, you're diabetic. What the hell are you doing? I said, no, I'm fine now. I said, what do you mean you're fine now? Give me a phone. I looked up his blood reports, and guess what? His sugars has been under control for over a year and a half.
Wow.
And for Indians, the biggest issue for us in diabetes is the postprandial increase in sugar, which is 2 hours after you eat, the sugar levels are very high. That's the worst one, right? So I said, Dad, I told you have to measure 2 hours after you eat. I said, yeah, I know you told me that part, but that's been normal for almost a year now. So I stopped measuring that now. It's always been a normal now. So first of all, I couldn't believe it. I never put two and two together. There was glutathione was doing all this work, by the way. I could not figure that portion out yet. I said, Dad, don't worry about it. Please promise me that you continue walking 30 minutes per day, every single day. So that way, at least exercise is in there. And I know you have arthritis, so it should be okay. Oh, no, I have no pain anymore. But let me show you. He showed me his health app. And on the app, he was walking 6 miles a day, every day.
Wow.
And so I said, wait a second, something's changing, right? But I thought because he has some better lifestyle, I don't know. You know what I was thinking? Well, maybe we're doing good right now. I don't know, right? I was too busy in my own work. I neglected to see his journey of progress. That was my fault. And then a couple of years goes by, and he comes to me and said, hey, I went to a chiropractor and said my hips are not aligned properly because my knees are buckling. So I need to get a knee replacement surgery done. I said, okay, you're 84 now. He goes, that's good. Let me take you to orthopedic surgery. I kind of shoot them off for about 6 months. I go, Dad, I got to get this thing done now. I can't walk anymore properly, and my hips are bothering me now. So knee surgery, the doctor's surgery goes, oh my God, he has no pain. I said, nope, his knees are completely deformed. Right? After 40 plus years, his knees are completely deformed. I said, well, he needs both knees replaced. I said, okay. Both knee at the same time possible? I said, and he goes, no, one at a time. I said, no, my dad says both knee at the same time because he's not going to come back for this painful surgery 2 years in a row. I said, there's no way. He's already 84. He's not going to come back for another surgery. There's not a chance. I said, well, the recovery is going to be hard. So if you want to do it, I'll do it. But the recovery is going to be hard. He can't travel for 6 months. And sure enough, the surgery was done. He was good. He walked out of the hospital in 2 days. In 2 days, he walked out of the hospital. Painful, but he walked out of the hospital. So surgery was successful. Everything was great. 1 month goes by. He recovered pretty fast and all those things. And a 3-month follow-up, I took him to the follow-up visit to the doctor, and he said, Mr. Patel, you're doing amazing. Your recovery is really, really, I can't believe it. The recovery is so good. I mean, I said, I'm already walking 2 miles a day right now. It's already been 3 months now, so you're already walking 2 miles per day. I said, I'm doing great. I said, you look good. Everything is amazing. And he goes, so can I travel? And the doctor goes, sure you can travel. I said, good. I already booked my ticket from next week. He was already prepared to go. In 3.5 months, he already went to India.
Wow.
Right? And I'll tell you the story from 78 to last year, because in the last 10 years, before 78, he was surviving. He was surviving. The last 10 years, he has taken 10 trips to India and Africa. He's been to every vacation we went to. We went to Costa Rica. We went to Yosemite National Park for a hiking trip. We went to Hawaii for a 7 excursion trips. We went to Alaska, and he was with us. He went to Australia and New Zealand went to walk the Glacier Mountain over there too. He did everything that he wanted to do in the last 10 years of his life.
Wow.
Right? Again, COVID happened. I said, Dad goes, just give me the bottles, just give me 12 bottles, and I'm gone. He just picks up the bottles and just leaves. He just leaves. He just goes. My mom passed away 25 years ago, so he's single. So he does everything on his own. Mm-hmm. So he was just traveling the world. Last year he was in India, traveling the world and just enjoying life and just eating street food. I said, Dad, don't eat street food. I said, I know I got some loose bowel movement now. I said, totally, just go to the restaurant, just eat at a restaurant or just cook something. You have a chef at your house, so have them cook something for you. So I know, I should do better, but I love the street foods over here. It's so amazing. Sure enough, 2 days goes by, the diarrhea gets worse, and he gets dehydrated. Bam, falls down in the shower, broke his skull. Okay? At the age of 89, you break your skull, what's going to happen? Oh,
that's usually not very good.
Not a good sign at all. I go to the hospital. The doctor he calls me for FaceTimes. I said, I'm fine. I said, oh my God, you're conscious, no loss of memory, and he's calling us. That's a good sign, right? I call one of my doctors. He's a neurosurgeon for NFL over here in the United States. I call him up right away. I say, my dad fell down in India. His internal bleeding happening, but he's coherent, he's conscious, he's no loss of memory. I said, okay, don't operate, don't do anything. Let me arrange for somebody. 2 hours later, there was somebody visiting my dad in India, watching over his shoulder to see what's happening. Because, hey, some internal bleeding happening, but if he survives the next 2-3 days, he'll be fine, right? So I said, my dad picks up the phone. I said, I told you, I'll be fine. Don't worry about it. It's just, I'll not eat street food out there. I'll be fine. He calls his brother, calls his sister, calls everybody around. So it's getting too late, puts the phone down and goes to sleep. And that was the last governance plan for him. He never wakes up, right? But the thing is, I tell this story for one reason. At the age of 89, until the last breath, he was connected with the world, with his family. He was not surviving. He was living his life. And so my thing is for everybody over here is that if you're in the survival mode, do something so you can start living your life again. Because if you're still alive, there's a chance you can still live your life. And that's my hope for all of your listeners today. Thank you very much.
That's such a beautiful sentiment. Thank you so much for sharing. I love that story. He wasn't surviving, he was thriving. Yeah, beautiful story. So thank you for sharing that and all the information you shared today. Just briefly, if people wanted to learn more about you or about your products, where would they go?
Absolutely. It's aurowellness.com. It's my website, aurowellness.com. I strongly suggest people to give it a 1 month try. We do offer 100% money back guarantee we don't ask any questions whatsoever. The results are so magical in my dictionary that I don't want anybody to be deprived of this product anymore. And so I am urging people to at least give it a 1 month try, because if you don't feel anything, that means your body is very healthy. If your body is not healthy, you are going to feel the difference.
Wonderful. Thank you so much, Dr. Patel. We really appreciate your time today.
Thank you so much.